Research applications cannot be defined in a single way, but it should be recognized that all research is conducted because it has potential applications. There is a purpose behind the research, and that purpose is essential. A research committee receives the proposal, consider its applications and the significance of the study, and decides whether to approve or reject it based on those considerations. Some research is done to benefit the masses, while others done for a specific reason.
So now we will tackle proposal development, preparation, and implementation. So research begins with a good idea. Good science is typically based on the nurse's researcher's identification of a problem that is amenable to study from a theoretical perspective, and existing evidence choosing a paradigmatic approach. This sets the stage for selecting one's methods to investigating the problem or developing the idea. Because the theoretical paradigm emerges from an iterative process, and because the theoretical perspective will subsequently drive the organization to the research study, it is important to distinguish between these two distinctive approaches, quantitative or qualitative, or some combination of both in mixed methods. Each approach can be facilitated at different points along the proposal process with select computer applications. This will be described as they relate to the methodology. So next is the quantitative or qualitative methodology. So the important distinction to be made between the quantitative and qualitative approaches is that for a quantitative study to be successful, the researcher is obliged to fully develop each aspect of the research proposal before collecting any data. That is a priority. Whereas for a qualitative study to be successful, the researcher is obligated to allow the data collected to determine the subsequent steps as it unfolds in the process or the analysis. Quantitative research is based on empiricism and logical positivism, with multiple steps and precision in quantification. It is hypothesis-driven and numerically descriptive, with the hypothesis tested statistically to support or refute predictions. Quantitative methodologies use statistics packages, but computers are not the only connection for researchers. Qualitative approaches such as phenomenology, hermeneutics, ethnography, and grounded theory share a common view of your reality, focusing on the meanings ascribed to data, such as persons' life experiences. In nursing qualitative studies, knowledge development is generated from participants' experiences and responses to health, illnesses, and treatments. The requirements of qualitative research depend on philosophical frames and new interview transcription, devices for data capture, and analytics software applications. So now we are down on the general considerations in proposal preparation. So the cloud has revolutionized the connectivity that has become indispensable for all users of software and sharing resources. It has facilitated development of the research proposal, communication with team members, documentation, and planning for the activities that will take place when implementing the study. This includes broad categories of cloud-based office programs, including word processing, spreadsheet, and database management application. Office 365 is the new release from Microsoft. Programs with cloud capability that continues to offer improved clerical tools to manage the text from numerous sources and assemble them in a cogent and organized package. The cloud connectivity gives researchers access to all programs and data virtually from anywhere. Now, cloud-based products from Google to Microsoft Office 365 provide capabilities in a platform into which other off-the-shelf applications can be integrated. Now, with cloud capability, can be integrated into the document for clear visual effects. This offers the researcher and grant manager tools to generate proposals, reports, and manuscripts that can be submitted electronically, directly, or following conversion to portable document formats or PDFs using Adobe Acrobat. So next is the research and study implementation. So in here, a funded research study becomes a logistical challenge for most researchers in managing the steps of the process. Numerous demands for information management require the researcher to maintain the fidelity of the procedures, manage the subject information and paper flow, and keep the data confidential and secure. These processes require researchers to use a database management system, or the DBMS, that is reliable. So several DBMS software applications exist and have evolved to assist the researcher in the overall process of study implementation. These applications are operations-oriented, used in non-research programs and projects as well, but can assist the researcher in management of time, personnel, money, products, and ultimately dissemination with reporting capability of reviews and audits. So the Microsoft Office 365 suite and Google systems include programs that first manage data in a relational database, or the Microsoft Access. Second, number crunch in a flat database, or the Microsoft Excel. And third, share through document storage with hyperlink web capabilities. So many of these proprietary systems can map out the research flow for enrollment of subjects, consenting, and data capture all together in one solution. So now CTMS, or Clinical Trial Management Software, is available from a variety of vendors. For example, one vendor, Trial by Fire Solution, is the team behind Simple Trials, an e-clinical software application with a focus on clinical trial management to improve planning, execution, and tracking of clinical trials. So in summary, the general considerations of developing and conducting a research study are based on philosophical approaches and will dictate which methodology the researcher will use to develop the study. This will subsequently influence the research and computer applications to be used in carrying out the project, followed by these steps of proposal preparation, depending on the choice of application most useful for the quantitative or qualitative study to be planned. After identifying the research problem, the researcher must proceed through the steps of the process where computers play an important role that is unique to each of the methodologies.
So hello everyone, for our next topic we have here the qualitative and the quantitative approach. Starting first with the quantitative approach, we have here data capture and data collection. Data capture and data collection are the processes that are viewed differently from the quantitative and the qualitative perspectives. Data collection can take a number of forms depending on the type of research and variables of interest. Computers are used in data collection for a paper and pencil surveys and questionnaires, as well as to capture physiological and clinical nursing information in quantitative or descriptive patient care research. There are also unique automated data capturing applications that have been developed recently that facilitate large group data capture in single contacts or allow paper versions of the questionnaires to be scanned directly into a database for a ready analysis or provided online with web-based survey tools. Next, we have paper and pencil questionnaires. Papers and booklet surveys do still exist today in data collection, but new enhancements aid the researcher in time-saving activities. Surveys and questionnaires can be scanned or programmed into a computer application. Researchers are also using computers for direct data entry into studies via automated data capture, where subjects enter their own responses via a device with simultaneous coding of responses to questions. These online survey tools can provide a wide range of application, including paper or portable versions, and range in price and functionality. Many proprietary tools have been automated to be executed by the researchers and distributed to the subject enrolled in the individual studies to capture data and efficiency on the web and provide a number of analytic and comparative norm reference subjects. We have automated data capture. Other examples of unique data capture in research include individual devices such as the Smart Cup, used to measure patient compliance with medication. The Medication Event Monitoring System, or the MEMS, automates digitized data that can be downloaded for analysis in research such as patient adherence studies, And a variety of online survey tools also provide researchers the power to collect data from a distance without postage using the internet. These applications can present questionnaire data in graphically desirable formats depending on the price and functionality of the software. To subjects delivered via email, websites, blogs, and even social networking sites such as Facebook or Twitter if desirable. Social media mechanisms such as vlogs and tweets are often providing source of data analysis, albeit questionably scientific, that have sometimes been harnessed to extract meanings for researchers. Next is the physiological data. The collection of patients' physiological parameters has long been used in physiological research. Some of these parameters can be measured directly from patient devices, such as cardiac monitoring of the heart rhythm, rate, and fluid of electrolytes, and be captured in the patient care records of the hospital systems. For example, hospitals have developed mechanisms to use information from intensive care unit or ICU data to calculate benchmarks for mortality and resources use. Now that many measurements taken from various types of imaging, for example the neurological, cardiovascular, and cellular, have become digitized, they can also be entered directly from the patient into the computer programs for analysis. Each of these applications is unique to the measures, such as system to capture cardiac functioning and or pulmonary capacity. Devices that can rely to contractions or monitors that pick up electronic signals remotely. Next, we have data mining. Data mining is a mechanism of exploration and analysis of large quantities of data in order to discover meaningful patterns and rules, applied to large physiological data sets as well as clinical sources of data. The nature of the data and the research questionnaire determine the tool selection, for example, data mining, algorithm, or technique. Analytics tools and consultants exist to help researchers unfamiliar with these data mining algorithms use data mining for analysis, prediction, and report purposes. Many of the first commercial applications of data mining were in customer profiling and marketing analysis. Today, many special terminologies or technologies can be applied, for example, to predict physiological phenomena such as genetic patterns with the promise of therapeutics in the next generation through genomics research. Next is the data coding. In most quantitative studies, the data for the variables of interest are collected for numerical analysis. These numerical values are entered into designated fields in the process of coding. Coding may be inherited in software programs for the physiological data and many of the electronic surveys. The coding may be generated by a computer program from measurements directly obtained through imaging or physiological monitoring, or entered into a computer by a patient or researcher from a printout or a questionnaire or survey into a database program. Most statistical programs contain data editors that permits the entry of data by the researcher as part of the statistical application. In such a situation, fields are designated and numerical values can be also entered into the appropriate fields without the use of an extra program. For mechanisms that translate the transfer of source data to prepare it for analysis, generic programs such as Microsoft Excel provide basic to complex statistical analysis and visualization options. Coding data is a precise operation that needs careful consideration and presents the researcher with challenges that warrant technical or cognitive applications. Coding data is a combination of cognitive decisions and mechanical clerical recording of responses in a numerical form with numerous places that errors can occur. Next is data analysis. There are many ways to consider data analysis. These considerations are focused around the broad types of research of interest in nursing and general research goals or questions. These goals may require different statistical examined or ions, for example, A. Descriptive and or explanatory analysis, B. Hypothesis testing, C. Estimation of confidence intervals, D. The model building through multivariate analysis, and E. The path analysis and structural equation model building. Various types of nursing research studies may contain a number of these goals. For example, to test an intervention using an experimental or quasi-experimental design. One may first perform descriptive or exploratory analysis, followed by test of hypotheses. Quality improvement, patient outcome, and survival analysis studies may likewise contain a number of different types of analyses, depending on the specific research questions. The different types of analysis required by the goals of the research will be addressed further. This description will be followed by examples of types of nursing research that incorporate some of these types of analyses. First, we have descriptive and exploratory analysis. The researcher may first explore the data means, modes, distribution pattern, and standard deviation and examine graphic representations such as scatter plots or bar graphs. Tests of association or significant differences may be explored through chi-squares, correlations, and various univariate, bivariate, and trivariate analyses, and an examination of quartiles. During this analysis process, the researcher may recode or transform data of mathematically multiplying or dividing scores by certain log or factor values. Combining several existing variables can also create a new variable. Next is the hypothesis testing or confirmatory analysis. Hypothesis testing and advanced analysis are based on an interest in relationships and describing what would occur if the null hypothesis is statistically rejected, leaving the alternative as true. These are conditional relationships based on the variables selected for study and the typical mathematical tables and software for determining p-values are accurate only insofar as the assumptions of the test are met. Next, we have model building, an application used for a confirmatory hypothesis testing approach to multivariate analysis is structural equation modeling or SEM. Byrne describes that procedure as consisting of two aspects. One, the causal processes under study are represented by a series of structural, example, the regression equations. The number two, and these structural relations can be modeled pictorially to enable a clearer conceptualization of the theory under study. The model can be tested statistically and a simultaneous analysis of the entire system of variables to determine the extent to which it is consistent with the data. Next, we have the meta-analysis. Meta-analysis is a technique that allows researchers to combine data across studies to achieve more focused estimates of population parameters and examine effects of phenomenon or intervention across multiple studies. It uses the effect size as a common metric of study effectiveness and deals with the statistical problems inherent in using individual significance tests in a number of different studies. It weighs study outcomes in proportion to their sample size and focuses on the size of the outcomes rather than whether they are significant. We have here the graphical data display and analysis. There are occasions when data need to be displayed graphically as part of the analysis and interpretation of the information or for more fundamental communication of the results of computations and analysis. Visualization software is becoming even more useful as the science of visualization in combination with new considerations of large data from the fourth paradigm unfolds. It was by Hay Tansley and Toll, 2009. These ideas began with the premise that the meaningful interpretation of data-intensive discoveries needs visualizations that facilitate understanding and unfolding of new patterns. And now we are down to the qualitative approach. Data capture and data collection in the qualitative approach focuses on activities in the steps of the research process that differ greatly from the quantitative methods in fundamental sources of data, collection techniques, coding analysis, and interpretation. Thus, the computer becomes a different kind of tool for the researcher in most aspects of the research, beginning with the capture and recording of narrative or textual data. In terms of qualitative research requiring narrative content analysis, the computer can be used to record observations, narrative statements of subjects, and memory and memos of the researcher in initial word processing applications for future coding. Software applications that aid researchers in transcription tasks, including text, scanner, voice recorders, and speech recognition software, and the new digital recorders are also on the market that use sophisticated and higher cost voice recognition software.
So at this point, we will talk about the information literacy and computerized information resources. So nurses use computers for many purposes. Recently, most of the focus has been on computerized patient records, acuity systems, and physician ordering systems. One of the major purposes for which computers can be used, however, is searching for information. Many resources are available on computer, and the information retrieved can be used to accomplish different ends. Computers also are available in various sizes, improving portability and availability wherever a nurse is practicing. So these resources, the information literacy and computerized information, aid in keeping current with the published literature, in developing a list of sources for practice, research, and or education, and in collaborating with colleagues. So what is information literacy? So information literacy is much more than computer literacy, although having basic computer skills is an aspect of information literacy skills. According to the University of Idaho Information Literacy Portal, information literacy is the capability to identify needed information, understand organization of information, identify appropriate information sources, locate these sources, critically evaluate the sources, and disseminate such information. So here we will go to information seeking behavior of registered nurses. So for the nurses to identify best evidence or seek information and apply it in the care of the patient, the nurse must apply the information literacy process as defined by the American Library Association. So first, the nurse should recognize the need for evidence, then know how to search and find the relevant information, then access, utilize, and evaluate such information within the practice environment. Maintaining currency with the published literature. So it is obvious that one of the most important obligations a nurse must meet is to maintain currency in her or his field of practice. Hence, they need accessible resources to answer practice-related questions and ensure that they are practicing with the latest and most evidence-based information. So computerized information, on the other hand, is the data and content that is stored, processed, and accessed using computer systems. It is often digital and can be easily retrieved, manipulated, and disseminated using various technological devices and software. So we have two types here: the essential computerized resources and bibliographic retrieval system. So essential computerized resources, it maintains the currency including bibliographic retrieval systems for the journal literature, point of care tools, and currently published books. So all of this assist the nurse in gathering the most current and reliable information. So the bibliographic retrieval system, it allows the nurse to retrieve a list of citations containing bibliographic details of the material indexed, subject headings, and the author abstracts. So the nurse can search this system using specific subject headings or keywords. So most bibliographic retrieval system has a controlled vocabulary, also known as the thesaurus or subject heading lists, to make electronic subject searching much easier. So one example of this is the PubMed or Medline. It is a free database of biomedical literature, contains millions of citations and abstracts from biomedical and life science journals, and widely used by healthcare professionals and researchers to access peer-reviewed articles and clinical research.
Nursing and healthcare informatics are often described as sciences in the literature. Electronic health is usually defined more broadly as a set of activities, processes, or means for the delivery of health services using information and communication technologies at both the macro and the micro levels. For this day, I am going to tackle the last topic, which is the international organizations influencing e-health and nursing. With advances in the healthcare technology, international health-related organizations have focused their efforts on exploiting the potential of electronic health for improvements in healthcare delivery and infrastructure. So there are programs and organizations that are being established to respond to the development and growth of e-health policy and applications internationally. So first is the International Council of Nurses, or the ICN. It is the world's first and most extensively reaching international organization for health professionals. The ICN is a federation of more than 130 national nurses associations and represents more than 20 million nurses worldwide. In short, the International Council of Nurses seeks to transform nursing and improve health through the visionary application of ICT, or the Information and Communication Technology, which the International Council of Nurses aims to support electronic health practice to be recognized as an authority on electronic health and to promote nurses as experts in the electronic health international community. Next, we have the World Health Organization. It is the authority for directing and coordinating health within the United Nations system. It provides leadership on global health matters such as shaping the health research agenda, setting norms and standards, articulating evidence-based policy options, and providing technical support to countries, especially in monitoring and assessing health trends, in which the World Health Organization works worldwide to promote health and keeping the world safe, which they states that their goal is to ensure that 1 billion more people have universal health coverage, to protect 1 billion more people from health emergencies, and provide a further billion people with better health and well-being. Next, the International Medical Informatics Association. Established in 1979, an independent non-governmental organization made up of national medical informatics associations. It plays a global role in the application of information science and technology in the fields of health and biomedical informatics. The International Medical Informatics Association has a special interest group which called the International Medical Informatics Association Nursing Informatics Special Interest Group that focuses on nursing informatics. It is to foster collaboration among nurses and others who are interested in nursing informatics to facilitate development in the field, and it aims to share knowledge, experience, and ideas with nurses and healthcare providers worldwide about the practice of nursing informatics and the benefits of enhanced information management. Next, we have the International Organization for Standardization. It was founded in 1947, and since then, it has published more than 22,656 reports that addressed almost all aspects of technology and business, including health. This organization is the world's largest developer of voluntary international standards. The ISO standards provide state-of-the-art specifications for products, services, and best practices to make the industry more efficient and effective. And one of the most important products of the ISO for nursing is the international standard. Its purpose is to establish a nursing reference terminology model consistent with the goals and objectives of other specific health terminology models in order to provide a more unified reference health model. This ISO standard has been used to evaluate and support the ongoing development of nursing terminologies, especially in supporting the definition of high-level schemata in developing logic-based compositional terminologies. The SNOMED International, a not-for-profit organization based in the United Kingdom. Its primary purpose is to develop and maintain SNOMED clinical terms. The organization focuses on supporting the implementation of interoperable and semantically accurate health record documentation. The International Council of Nurses, or the ICN, is aware of the need to collaborate with SNOMED International to assure nursing domain content is available to nurses in SNOMED International member countries. And with that, in 2010, the International Council of Nurses announced a collaborative agreement with SNOMED International to advance the terminology harmonization and foster the interoperability in health information systems and to provide a vehicle for transforming the ICNP encoded data into SNOMED clinical terms. The International Society for Telemedicine and Electronic Health is a non-profit organization, and its mission is to facilitate the international dissemination of knowledge and experience, as well as to support developing countries in the fields of telemedicine and electronic health. The International Society for Telemedicine and E-Health only want is to promote and support the telemedicine and e-health activities worldwide. It supports the developing countries and assists the startup of new national organizations. So the objective of the International Society for Telemedicine and E-Health Telenursing Working Group is to support technology, businesses, and professional actions for telehealth nursing. These actions include advocating for increased use and evaluation of telehealth services by nurses, stimulating innovative ideas and promoting initiatives for further development of e-health, advancing nurses' knowledge and skills in telehealth through the dissemination of research findings and education programs and practice guidelines, and advocating for the ethical use of telehealth services. So next, we have the Healthcare Information and Management System Society. It is a global, not-for-profit organization that focused on better health through the information and communication technology. The Healthcare Information Management System Society leads collaboratives and conferences to promote the positive use of the ICT in healthcare. The Healthcare Information Management System Society conferences in the United States, Europe, and Asia Pacific showcase the exhibitors that represent commercial and non-commercial interest in the health ICT industry. The Healthcare Information Management System Society seeks to reach out to all the nurses and promote the involvement of those working in nursing informatics and to provide domain expertise, leadership, and guidance to the organization's activities, initiatives, and collaborations with the global nursing informatics and e-health communities. The next organization is the TIGER, which stands for Technology Informatics Guiding Education Reform. So Tiger began in 2006 with support from over 70 organizations, and the focus of Tiger is on the development of a clinical workforce that can use technology to improve the delivery of care, which is the Healthcare Information Management System Society, currently hosts the Tiger. And one of its key products is a virtual learning environment that acts as a portal to online resources that support the educational reform. Lastly, the Health Level 7 International. It is a not-for-profit standards development organization dedicated to providing a comprehensive framework and related standards for the exchange, integration, sharing, and retrieval of electronic health information that supports the clinical practice and the management, delivery, and evaluation of health services. So, the level 7 refers to the seventh level of the International Organization for Standardization, the seven-layer communications model for open systems interconnection at the application level. So the vision of Health Level 7 International is to create the best and most widely used standards in healthcare in order to improve care delivery, optimize workflow, reduce ambiguity, and enhance knowledge transfer among all stakeholders, including healthcare providers, government agency, the vendor community, fellow standards development organizations, and the patients.
Good day everyone, my name is Andrejan M. Dungan and I'll be presenting the last topic, which is the applications in global electronic health and informatics. With new technologies, the collection, storage, and transmission of health data and information are changing how healthcare is delivered. Nurses are leading advances in electronic health worldwide, and in this section, selected applications for e-health are discussed to provide an understanding of current nursing research, education, and practice in this area. Specifically, examples of innovations in the advancement of the electronic health record and telehealth are described. As one of the major innovations in healthcare, the EHR has brought both challenges and hope for the improved healthcare delivery system and our better health outcomes for people worldwide. Out of 121 countries participated in the survey, 57 countries reported having introduced a national EHR systems. Countries answered no national EHR system still have some form of EHR system used in local or regional facilities. These countries with national EHR systems have strongly supported and promoted standardization, interoperability, and information sharing among healthcare providers. The ability to document healthcare using standardized interoperable system application is recognized as essential to unleashing the tremendous capacity offered by information sharing through the EHR. Electronic capture, storage, and retrieval of comparable health data across providers, settings, and specialties are basis for measuring value of the EHR. Additionally, as the AHR evolves, nurses will use this new technology to support the shift from a provider-centered health system to consumer-centric model of healthcare. Various AHR applications will facilitate nurses' access to their patients and patients' access to their healthcare providers. For telehealth and mobile health in electronic health environment, research in this area is growing and there are many examples including those conducted by nurses themselves and by nursing students in ICU, surgery, orthopedics, and neurology, and in the field of communicable disease, non-communicable disease, and also mental health.